Rec- All right. Can everybody see that okay? Or I know we're muted, but
Yeah.
thumbs up. Okay. All right, so we can go ahead and get started.
Okay, so thanks for the introduction, Dr. Pulido. And yes, my name is Dr. Raymond Pulido, but please call me Ray. I have my doctorate in physical therapy, and I specialize in helping older adults that have challenges with their balance, or they might be worried about falling, or they may have had fallen before, or maybe they're dizzy, and I help them minimize their risk for falls. I want to take a moment to thank Here Care for allowing me to talk to everyone this afternoon and share my knowledge today. And starting today, if you haven't met me, I want to be a resource for you. So I want to be the dizziness and balance go-to person, whether you're a clinician at Here Care or a patient at Here Care or at the Pines. I'm going to leave my contact information at the end of the slides. So any questions that I don't get to today, or any questions that you think of later today or tomorrow or next week, I want you to call me or email me, and I'll be happy to help. All right, next slide.
Can everyone hear him okay? Hopefully. I don't know if you can be louder or not, but
Oh, I can be louder.
okay.
I'll do the
Oh,
next
I'm
slide.
sorry. I'm the one recording. There you go.
All right, so we're here because we want to talk about falls that we can prevent. Next slide. This topic is meaningful to me because I actually lost my grandmother to complications from a fall 3 years ago. She passed away 3 years ago from a fall. So that's me and her when I was a little bit younger in Florida. Next slide. So a third of Americans 65 and older fall each year. It is a serious problem. Those who fall once are more likely to fall again. And there's a higher percentage of 65 plus in Sarasota. So as a city, as a community, this is more meaningful. This problem is definitely a concern for a lot of ourselves, our neighbors, and family. Next slide. And 1/2 of all falls are preventable. And I'm going to talk to you today about what you can do to prevent those falls. Next slide. So what is balance? Let's talk about it. Next slide. So there's information that we get from our eyes, our inner ear, and also our feet. And all that information comes together in our brain and gives us information on our balance. So if there's something going on with any of these body parts, like for example, if someone has reduced vision, or maybe you're trying to walk around in the dark, going to the bathroom at 2 a.m, then that's going to make it more challenging for your balance. For your inner ear, say you wake up one morning and you're dizzy. If you're feeling dizzy, that's going to make it harder for you to balance as well. And lastly, as far as the information from the feet, if anyone knows someone, or if you yourself have neuropathy as a complication from diabetes, then if you have numb feet or painful feet, then it's going to be harder for you to balance as well. Next slide. Next. And so your eyes and your inner ear and your feet might be completely normal for your age. Unfortunately, with normal age-related changes, naturally it is going to be tougher for an older adult to balance easily, effortlessly compared to years before. Next slide. And if you have some other medical conditions such as Parkinson's, low blood pressure, diabetes, if you have had a stroke in the past, if you have pain in any part of your body, I've talked about neuropathy, and also if you're dizzy, then that's going to add to the different challenges to your balance, in addition to these normal age-related changes in regards to making it more difficult to balance when you're standing and walking and doing your everyday activities. Next slide. So I want to talk about some different medical conditions that can cause someone to feel dizzy. Probably the most, not probably, definitely the most common is what's called BPPV. And that vertigo is a sensation that you yourself or your surroundings are spinning. Also, the signs and symptoms of this dizziness, this type of dizziness, usually lasts seconds. And if you're dizzy, that might increase your risk for falling. So probably what I've heard the most is if I roll over in bed, I feel really dizzy, but it goes away after 15 seconds. You know, if I'm sitting watching television, it doesn't bother me. If I'm walking, I'm okay. But if I roll over in bed, or maybe I put some eye drops in my eyes or reach under a cupboard for a can of soup, then I get that dizzy feeling for less than a minute, and then it goes away and I'm fine. So that's probably BPPV. Next slide. So aging can cause this loosening of the ear crystals to cause the short-term dizziness. I took care of a younger man once, and he was in construction. So he was the same age as me. He was in his mid-30s, and he was doing a lot of shaking with his construction work, and that can sometimes loosen the ear crystals. And if they get dislodged and go in the incorrect place of the inner ear, that can cause someone to feel dizzy. And it tends to be more common in females, and it could be hereditary. Next slide. The good news is that BPPV is treatable. It can take maybe 1 or 2 treatments. The physical therapist, like myself, can help you reposition your head so that the dizziness symptoms go away. Next slide. So there's some other causes of dizziness. We won't have time to talk about every cause of dizziness today. I'll just talk about a couple more. But if you're getting vertigo, that's not necessarily related to, laying down or rolling over in bed. If you've had a recent infection, if you have a new hearing loss or ringing of the ears, then that's definitely something that you want to go get checked out by an audiologist. Next slide. And with Meniere's, it's even more severe vertigo lasting for hours. Again, with the hearing loss, the ringing of the ears, and a feeling of fullness in your ear. Next slide. So the take-home message here is that if you get dizzy, you have a new hearing loss, then you should definitely be seen by an audiologist for a hearing evaluation. Next slide. So what can we do to prevent falls? Well, I'll tell you. Next slide. So by being afraid of falling, in and of itself, you have increased your risk for falling. So if falling is a concern, if you're weary about it, if you're careful about it, then that by itself increases your risk for falling. So if you're watching this Zoom talk, then it's probably a concern, but it's actually good that you're watching the Zoom talk so you can do something about it. If your risk for falling is already increased, there are things you can do to reduce your fall risk, and that's what I'm going to talk about next. Next slide. Now, there's a lot of information on uh, this slide, and it's probably the best slide in the whole presentation. If I got this information from the CDC, so if you would like me to send you the document, like I said, I'll leave my email at the end of the slides and I'll send you that information directly. But the things that the CDC recommends that you can do to prevent falls are: one, exercise. So activities such as walking, Tai Chi, yoga, dancing, to help you stay strong and flexible and improve your balance. And make sure you keep up with your exercise program if your doctor or therapist has given you one. And the nice thing about working with a physical therapist is that they can tailor that exercise program to you. So if you do have Parkinson's, if you do have pain in your joints, if you do have neuropathy in your feet from as a complication of diabetes, if you're dizzy, physical therapists are trained to give you that exercise program to help you reduce your fall risk. Another thing you can do, and one more thing about exercise, the kind of exercise that you do matters. So, I've had patients tell me, I ride a bike for an hour 3 times a week, but my balance is still not good. Or I run a half marathon once a month and my balance is still not good. Or I walk across the pool and I do pool aerobics for 3 times a week and my balance is still not good. There's this concept in exercise physiology, which is my bachelor's. It's called specificity of training. And for those people that are not exercise people or not exercise physiologists, basically, if you want to get good at balance, you have to practice balance exercise. If you want to get good at running, you have to run. If you have to get good at playing piano, you have to play the piano. Just general exercise is just not enough to really reduce your fall risk. And as far as in the medical community, as far as the CDC, if you want exercise guidance, the gold standard is working with a physical therapist to get the best exercise for your preventing falls. Medications. So you want to talk to your healthcare provider about the medicines that you take, including prescriptions, over-the-counter medicines, and supplements. Some combinations of medicines can make you feel tired or dizzy. These side effects can increase your chance of falling. I have a patient, I won't share his name. I just worked with him this morning, but he has a fall risk too. He actually has fallen recently. And I discovered from taking his blood pressure during exercise that every time he would stand up, his blood pressure would drop. His normal blood pressure is ballpark around 120/80. And anytime he would do a standing exercise, his blood pressure would drop, systolic would drop to the 90s. And so it doesn't matter how much he exercises, if you stand up and you're not getting enough blood to your brain, you're going to feel lightheaded, you're going to feel dizzy, and you're likely going to lose your balance. So that's something that you have to talk to a pharmacist about, or talk to your cardiologist about, or your just general doctor, primary care physician, to see if any of the medicines that you're taking is causing you to feel dizzy or possibly might make you lose your balance. Have your vision checked. Your vision should be checked by an eye doctor every year. Wearing the correct prescription lenses will make sure you can see clearly. If your vision is poor, your chances of falling are higher. like I said earlier, vision is one of the senses in our body that helps us with our balance. I don't recommend that you actually do it, but let's say if I stood up and I close my eyes, it's going to be tougher to balance with my eyes closed. That's why I don't recommend that you try to walk to the bathroom late at night in the dark to just turn the lights on or use a flashlight. Wear supportive shoes. You want to wear shoes that fit snugly with non-slip soles and a flat or low wide heel. Avoid slippers. I know that's tough for us because we're Floridians, or many of us. Avoid flip-flops. Avoid backless shoes. High heels. Avoid high heels. And avoid shoes with smooth leather soles. And lastly, make your living environment safe. So remove tripping hazards such as loose rugs and clutter, add handrails to stairs and bathrooms, use non-slip mats in the bathtub and shower, and add lighting in dark areas. Next slide. All right, so physical therapy. And this goes for, I mean, of course, I'm going to recommend the Pines where I work and myself because I'm an expert in this area of balance and falls disorders and helping older adults reduce their risk for falls. But wherever you are, if balance is a concern, really the best medical professional to seek is a physical therapist. Of course, once you get cleared by your medical doctor, like if you have something medically going on, like Parkinson's, or if you've had a stroke, or if you have diabetes, then yeah, you have to go get that checked out first. But once you're cleared for therapy, then if you're really serious about reducing and minimizing your risk for falls, then a physical therapist is the best medical professional to work with because we do specialized testing to determine what treatment and what exercises work best for you. Exercises for someone with painful knees is going to be different for someone that they're dizzy because they have migraines. Just because both people want to not fall, but they have different medical conditions, it's a physical therapist that's just going to choose the best exercises for you. It's one-on-one, the exercise. If it's Medicare, if you have Medicare, then Medicare rules is that the therapy is one-on-one. Here at the Pines, the therapy is one-on-one, and physical therapy is covered by Medicare and insurance. Next slide. So I think Dr. Pulido is gonna play a quick video.
Sorry, I didn't realize I was muted. Yeah, I'll play the video now. Let's try. Let's see if I can. Share sound. I'm trying to get the video, the sound, share sound. Okay, let's see if this works here.
Remember full screen.
Like that.
Yep.
Pines of Sarasota Rehabilitation and Senior Care Community.
I feel like I'm getting the finest therapy in the country. My therapist graduated with a doctorate in physical therapy. Someone so highly trained could give me the best help that I need in gaining my balance again and do all the things I used to do.
There's really only one choice. Pines of Sarasota Rehabilitation and Senior Care Community.
All right. Let me go back to the, oop. Let me go back to, could you hear that okay?
Yeah.
Okay. So let me do, okay. Oops. Let me share again. Share again. Okay, thanks for being patient here. Okay, there we go.
Okay, so like I mentioned in the beginning of the presentation, I want to be a resource for you, whether you're local, whether you're in Sarasota or elsewhere. If you have any questions about balance, dizziness, preventing falls, physical therapy, please please email me. And I've left our office number as well. If you would like me to give you a free falls risk assessment, whether it be in person or on Zoom or on the phone, I'm offering that as well. And again, I want to thank Dr. Pulido and HereCare for having me today. And I'll just open it up for questions now.
Yeah, we have about 10 people, so I think if anyone has a question, they can go ahead and unmute and ask their question unless they feel like they would want to put it in the chat. I'll leave this screen up for a little bit.
I have a question.
Yes.
Can you hear me okay?
Mr. Stricker?
Yes.
Yes, hi, yes.
My comment and question is that I've always had a balance problem in my entire life and did a lot of physical therapy over it. And the physical therapist, I don't know, 10 years ago or so, concluded that at the time I was around 6'2" and my feet were not long enough or big enough for a 6'2" person. And what do you think about that situation?
I mean, it's very possible for it to be more challenging to balance if your feet are smaller compared to your frame. I don't know. I've never seen any norms as far as appropriate foot size compared to height. It could be just expert opinion, which is fine because right now this is expert opinion. But if you have problems with your balance since 10 years ago, have you kept up with your exercises since then?
Yes and no. I exercise a lot, but recently I moved and that's taken all my time.
Yeah. So definitely, get back with your exercises, or better yet, consult or get a new prescription to work with a physical therapist in order to take a look at your exercise program and get you going with better balance again. But I mean, if someone is walking and if someone is living at home and independent, then it's very possible to improve your balance than it already is. And you don't have to be limited by your anatomy or what some expert said 10 years ago. I mean, it can get better.
Are you located on Orange?
Correct.
What's the number? The street number?
Oh,
it's on the screen. Am I still
it's on the
sharing?
screen. It's
What's the number on there?
941-309-5714.
No, I'm not talking about the phone number, I'm the house number.
Oh, it's 1501.
Oh, thank you.
Does anyone else have a question about falls or balance, dizziness, anything like that? Oh, Kay, are you trying to talk? You're muted. Sorry, I can unmute you. I'm trying to unmute you. Let me see. It looks like I can't unmute you. There you go. Can you
All
say that
right.
again, Kay? There you go.
How do you know when is an appropriate time to seek you out and say, I'm feeling a little awkward. I don't know if I really need help, or when is an appropriate time?
Oh, great question. If a person feels like their balance is not as it should be, if they feel like they're gonna fall and injure themselves, or they have to be, extra careful to just step down a curb, or they're maybe not playing golf anymore or tennis anymore because they're concerned about falling and hurting themselves, then that's the time to talk to your doctor and say, you know what, my balance isn't what it should be, I believe. Say I'm an 80 something person. I don't know. I'm talking like a person that's not a physical therapist, like a just a regular older adult. It's like, okay, I'm 81. I don't know how 81-year-old person should be walking and moving. Should I give up tennis and golf, or you know, or should I start using a cane? I simply don't know. So how you find that information is you talk to your doctor and say, I have concerns about my balance. I want to talk to a physical therapist about it. And then the physical therapist can do the testing and determine, okay, based on your body and what you can do and what medical conditions you do or do not have, then you can figure out, okay, should I use a device? Or should I play sports that I gave up? Or, are there certain exercises that I haven't already been doing that can improve my quality of life and make me feel better about, walking and not feeling like I'm going to fall?
May I also add that with your help and you're prodding me along to challenge my balance, I'm back to kayaking again at 81 and a half, or 2/3.
Wow.
And yeah, I mean, it's been a wonderful experience for me, and I can't thank you enough for your help in helping me get back to things that I really enjoy. So thank you.
Thanks, Ken.
Oh, wow, that's great. All right, we have about 5 minutes left. So do we have any more last minute questions?
Yeah, I have a question on the Medicare coverage. Does the doctor have to approve? The medical doctor has to approve that I need physical therapy?
And that's correct. So physical therapy for balance or really any other medical condition is a covered medical service by Medicare. And in order to bill Medicare for the service, then we do require a physician's prescription. And that prescription would say, physical therapy, evaluate and treat for balance or low back pain or shoulder pain. And if you have more questions about that, I encourage you to email me or call me on the number on the screen there.
Thank you.
All right, for those of you that came a little bit later, this is recorded, and we're gonna put it on our Hear Care Audiology YouTube channel if you want to rewatch the whole presentation, okay? Okay, it looks like we are good to go. Thank you everyone for coming, all the participants, and for Dr. Pulido for agreeing to do this talk with us. I learned a lot. I hope all of you learned a lot too. And feel free to contact Hear Care if you have any questions about the presentation or about hearing evaluations, and please contact Dr. Pulido if you have any questions about the fall risk assessment or any questions about physical therapy at all, okay? All right.
Dr. Pulido.
Yes.
Thank
Oh,
you
yeah,
very
which one?
Oh, definitely Dr. Raymond, because
Right.
I've yet to meet you.
Yes, I. All right.
Thank you very much.
All right. Thank you all
Thank
for
you.
coming. I hope you have a great day.
Bye-bye.
Bye.
Bye.